My name is Kelly Parsons. I'm a family care coordinator at Sanders Brown Center on Aging. I've been working with the aging population for over 15 years. All right, so today I'm going to be talking about advanced care planning and community resources during a time of COVID-19. Some of this information that I'm going to be talking about today was shared by Dr. Jessica McFarland at an advanced directive workshop that was held by Sanders Brown last spring. If you're interested in watching her full presentation, that can be found on our YouTube channel. Just search Sanders Brown Center on Aging within the YouTube search bar, and you'll be able to find that wonderful presentation Dr. McFarland gave. So during this conversation, we're going to talk about how to start talking about maybe things that you will want if you're not able to let your wishes be known for any specific reason. We'll go over some definitions of advanced care planning and what that means, and then we'll also talk about community resources that may be beneficial to you during this time of social distancing and being healthy at home. Okay, so there we go. All right, so documents and connections. These are just a few things that we're going to be covering today. If I do move a little fast, if you're unable to write something down that you'd like to get down, I will be giving my contact information on the last slide and letting people know what that is if you're on the phone with us today. Feel free to give me a call or email me with any questions related to this conversation or any type of referral information. I'm happy to help. All right. So let's first kind of just talk about putting things in order, right? We've got lots of documents, deeds, titles, insurance policies, burial information, legal papers like wills, durable powers of attorney. It's really important, especially if we're healthy at home and maybe we have some time and maybe we don't have some time right now, and that's okay. But it is important to try to gather these things together, have them in one place, and then let somebody who you trust and know where these documents are in case you are unable to talk or tell someone. If you get admitted to the hospital because of a car wreck, or possibly you have high blood pressure and God forbid you have a stroke and you're not able to communicate where these documents are, having someone you know and trust know exactly where everything is. They can get the insurance document, they can get your Medicare card, all of those things really helps kind of lessen the burden of a crisis. All right, so we're going to talk about advanced directives. They are called a lot of different things, and we'll kind of go over them. But an advanced directive is written instructions for future medical care in case you are unable to make or communicate decisions. For example, if you're unconscious or if you don't have capacity to make a decision. So advanced directives are also called healthcare directives. And there are a few different forms and documents that can be used to really articulate or specify what your healthcare preferences are. Advanced directives can also be called a healthcare proxy. So already it's a little bit confusing. You've got healthcare directives, advanced directives, a healthcare proxy kind of as the umbrella. And under that umbrella, you care. And the durable power of attorney is a legal document that is naming a healthcare surrogate. And this is someone to make medical decisions for you at times when you're unable to do so. And the word durable just means it remains in effect even if you become unable to make decisions. So a living will also can be an advanced directive. A living will is a written document that helps you tell your doctors how you want to be treated if you are dying or unconscious and cannot make your own decisions about emergency treatment. So a healthcare surrogate, that is actually the person who you decide who will make decisions about your medical care if you're unable to make them for yourself. They can also be called a healthcare agent, a power of attorney for healthcare, So many different names again, but it all really kind of means the same thing. And advanced directives allows you to make medical decisions for yourself, even if at that moment when you need those medical interventions, you are not able to physically speak those. These are all legal documents, legal and binding. All right. So the University of Kentucky Healthcare uses the 5 Wishes Advance Directive. This is a wonderful document. If you would like me to mail you a copy of this document, I'm happy to. Again, I'll give you my contact information at the end of this webinar. But 5 Wishes really kind of goes through and explains what matters most to you, what you would like to do. I always say the 2 most important things when filling out 5 wishes is, first and foremost, pick a person that you trust. It can be a family member, it can be a neighbor, it can be a spiritual or religious leader, it can be a lawyer. Pick somebody that you trust, assign them that healthcare surrogate privilege, let them know that you've done that. And then on 5 wishes, there's 2 different ways. Each document in regards to the durable healthcare power of attorney, the living will, the 5 wishes, each does it a little bit differently as far as if you need a notary, or if you just need a signature. Within the 5 wishes document, you can do it one of 2 ways. You can have non-family members, 2 witnesses, sign that piece of paper when you sign it, or you can have it notarized. Make copies of that, give that copy to the person that you've designated as your healthcare decision maker. Give that copy to other family members, or your primary care physician is a good person to give that to. But really, this is the decisions you're going to be making within this document is, who can I trust to make decisions? What types of medical treatment do I want? Do I want, if a doctor says you need a feeding tube, what are some of those questions that you would have in regards to if you would get a feeding tube or not? It's also really important, if you haven't talked to your medical provider about different types of treatment, take this 5 wishes or another advanced directive into your appointment. Maybe you're doing it telehealth and you've got your yearly well check coming up. Ask your physician about questions that you have in regards to, maybe you'll need dialysis, maybe you'll need to be intubated, and we'll talk a little bit more about that as well. But really think about what's important for your comfort and your dignity and what you want. And then share with your loved ones what those choices are. Now, this is a difficult conversation, and sometimes it can be a really scary conversation. And so sometimes when you're thinking about you yourself, or maybe someone you love in regards to filling out this document, you need maybe a little bit of a jumping off point. So you can use what's happening in popular culture or something that you've seen. For instance, I was reading an article on Facebook, and the post really made me realize I wasn't sure what your wishes are. If you get really sick, can we have that conversation? Or maybe just talk to a friend. Bob and I were having a conversation, and I wanted to let you know that he's my decision maker in regards to if I can't speak for myself for healthcare. Do you have a decision maker? And then as you're talking about this, ask for clarifying questions. So, I remember you once said, when it comes to medical treatment, you want the whole enchilada. My husband actually did say something very similar to that. What exactly do you mean by that? And what exactly he meant by that, my husband, is that he wanted to be on a ventilator, and he has a very set time of how long he wants to be on a ventilator for. And that's a conversation that we've had and that I'm aware of. If, God forbid something does happen, I know that I'm going to fulfill his wishes. And then, when you're having this conversation with your loved ones, kind of summarize to make sure you really know things that they are thinking about. Um, I know you don't like talking about this. Is always a good way to start because uh, it is scary, and but ensuring you honor their decisions, that you honor their wishes, is really important. So, what does this mean during COVID? A lot more people are having this conversation because there is a crisis event happening all around us to everyone. Um, so, the Conversation Project is a really great resource in regards to start thinking about what you might want. Um, so, in regards to advanced directives in a time of COVID, think about what would be most important to you. Would being comfortable be important, or trying all of the possible treatments? Remember, there's no wrong decision in this, it's your decision. What are you most worried about if you get COVID-19? Are you worried about being alone? Are you worried about being in pain? Are you worried about being a burden? These are things that you can go through and really hone in on with an advanced directive and with those conversations with your loved ones. And then what is helping you through this difficult time? Is it your faith? Is it your family? What's important to you? Do you have a pet bird or a cat that you really love? And that's something that maybe the healthcare workers, if you do get hospitalized or caring for you, can talk about with you, because there is um, such a different look of care these days, because everybody is masked and gowned. And so what are some of the things that they can connect with you if you're not able to tell them? If you have an advanced directive, and Five Wishes does have a place in it, I think it's the fourth wish, about what you want healthcare workers, or what you want your family and friends to know about you. And you can put these things so they can talk about, you know, a favorite pet, or a favorite time of year, or a favorite flower that's coming up right now. You also want to think about DNR, do not resuscitate orders, organ and tissue donations. A DNR is a medical order, and it tells the medical staff in a hospital or nursing facility that you do not want to try to return your heart to a normal rhythm if it stops beating unsustainably using CPR or other life support measures. Um, so a DNR order is a medical order that's signed by a physician. And again, these are other things to think about and have a conversation with your loved ones and with your medical provider. So if you decide to choose a healthcare proxy, really think about who you know, who shares your views and values about life and medical decisions. Your proxy might be a family member, a friend, a lawyer, someone in your social or spiritual community. Um, it, if you'd like to name an alternate person, you can do that. You can have two proxies, healthcare proxies. We do try to say limit to two, just because it's such an important decision. You don't want everyone to be able to make that decision. Give copies of your advanced directive to your healthcare surrogate or proxy. Give a copy to your doctor for your medical records. Tell close family members and friends. If you go to the hospital, if you can have a copy ready. A lot of people I know have a copy either in their freezer or on their refrigerator. And then keep track of who receives a copy in case you do need to make any changes. I will say, as a caveat to this, if you have a primary care physician, or a specialty like a cardiologist or a neurologist that you go to on a regular basis, it might be a really good idea to ask them for a release of information. And in that release of information, you can put your healthcare proxy on there. Again, you're trusting this person with a lot of information, but that way, if something were to happen, if you're at UK and you've got records at Baptist, your healthcare proxy, if you've already filled out that release of information, that HIPAA form, can send records straight over. Now they can, there's medical intervention is going to be okay. Medical facilities can request, and based on that request, if it's needed, they'll send that information. So I don't want you to think that things aren't going to be shared. If they need to be shared, they will. But this just adds another level of information and communication connection. So just something to think about. So when you're ready to fill out an advance directive, you want to think about what you want, you want to write it down, and you want to share it with others. So I'm going to move on into community resources during COVID. If you have any questions, I think you can type them out and then we can share them at the end of this conversation. Okay, so this is for Fayette County specifically. I'll let you know if it's county or regionally specific, if something that I'm sharing is county or regionally specific, and then give you some contact information for other counties aside from Fayette County. So the Fayette County Sheriff's Office has launched Operation Compassion during the time of COVID-19. If you need medications picked up, groceries picked up, or essential supplies, they're also passing out green light bulbs. You can call the Sheriff's Office at 859-252-1771. The Sheriff Office and any local sheriff office, so it doesn't have to be just Fayette County, any county sheriff office in Kentucky will also provide welfare checks. So if there's somebody that doesn't get out much and certainly isn't getting out much during this time, you can always call the sheriff office within the county and ask them to do a welfare check. You will need their address and their name, and then they will send some out to make sure they're okay. So this is some local assistance that we have. ITN of the Bluegrass is a fantastic organization. Typically what this is a ride sharing program. It's a membership program, and you, in a time, in a non-pandemic time, you would call and make appointments if you needed to go get your hair cut, or if you needed to go to the grocery store. Certainly that's a little bit different now. It's mainly focused during COVID-19 on delivery of groceries and sundries, or rides or delivery of medical equipment, supplies, and prescriptions. So they're giving free medically necessary eye care rides. They're providing pickup and delivery of essential foods, assistance placing a food order online, pickup and delivery of medication, assistance with pet care and pet food, that's really important, or medications for pets. And then they are also doing wellness check-in calls. They do have some low-income scholarships available, so certainly give them a call. They're within the Jessamine County, Fayette County area, and their number is 859-252-8665. Again, that's ITN of the Bluegrass, and they're a wonderful organization. LexCare is also a fantastic Lexington organization. This organization provides bus passes and assistance monetarily of up to $500 for someone every 5 years to kind of help make ends meet. You do need to be referred through a membership agency of LexCare for an application. The Lexington Senior Center can assist with this, and I'll talk more about senior centers in a couple of slides later. And then God's Pantry. God's Pantry has waived community referral applications. So you can call the number 859-255-6592 and receive immediate food assistance. The Operation Compassion program, the Fayette County Sheriff program, will pick up the food from God's Pantry to you and deliver it. This is a time where their numbers have increased exponentially, and they have really heeded the call. All of these organizations have. So ITN of the Bluegrass, LexCare, and God's Pantry are 3 local resources that can assist you during COVID-19, ensuring you stay safe and stay healthy at home. So another thing I wanted to talk about was the county clerk's office. The governor issued the executive order that they're gonna expand the absentee voting ballot for the June 23rd primary. They are doing most things online, um, which would include vehicle registration, voter registration, DD 214. So the DD 214 is a military discharge summary. You need a DD 214 for anything you would ever think that you needed to do for VA, veterans benefits, anything like that. The first thing that they're going to ask for is a DD 214. The county clerk office will help ensure you have a copy of the DD 214. The main line for the county clerk office is 859-253-3344. You can call them and ask about the apps. You can call and request an absentee ballot. And then the voter registration line is 859-255-8683. So I've got the Fayette County Clerk website on here. It's www.fayettecountyclerk.com. However, each county in Kentucky has a county clerk office, and they all will be able to individually help you locally with an absentee ballot. So something to keep in mind for the June 23rd primary or any other documents you might need, like vehicle registration. Okay, another amazing resource is the Area on Aging. The Area on Aging was actually established in the 1973 amendment to the 1965 Older Americans Act. It was just re-upped, I think, for another 5 years, maybe, or 10 this past session. So the Area on Aging does a lot of really fantastic things for our seniors within the community. There's 15 Area on Aging agencies within Kentucky. They are all on the screen here. The Bluegrass Area on Aging serves Fayette County and surrounding counties, Franklin, Scott, Madison, Harrodsburg. I always forget what county Harrodsburg is in. Winchester. The Bluegrass Area on Aging is 859-266-1116. They will have information on senior centers for you. They also have the Aging and Disability Resource Center. So if you are a senior in need, the Aging and Disability Resource Center will be able to find local resources to help meet your needs. They have what's called a National Family Caregiver Support Program. If you're caring for a senior of 65 or older, or somebody diagnosed with a dementia of, I believe it's 55 or older, the National Family Caregiver Support Program has a few benefits. Certainly local resources is a huge benefit. And then they also have respite care. This is a non-monetary program. So they're not going to ask how much money you have in the bank, how many assets you have. You do have to fill out an application, but it's really just to ensure you're providing care for a senior. And they will give you, I think it's about over $1,000 a year in respite care and about $300 a year in supplies. So if you needed chucks, if you needed a shower chair that Medicare wouldn't pay for, some of that could go through the National Family Caregiver Support Program. That program re-ups every July. I believe Bluegrass Area on Aging, it was running a little bit low in funds. However, in July, there'll be a reapply fund. And then they also have the home care program. There is a wait list for this, but you need to be 60 or older. And this is an asset base, so they are going to look at your funds monetarily. But you can have a case manager. You can have somebody coming in and helping meal preparation, housekeeping, things like that. But Area on Aging is a great resource, and Lexington has its own senior center, but other counties, especially more rural counties, their senior centers are kind of housed within the Area on Aging. So can't say enough great things about that. Okay, so senior centers. Again, if you're not in the Lexington area, call your local Area on Aging and they will have information for your senior centers. But they have really taken the call during COVID-19 and they are offering real support. So Lexington Senior Center, although it is closed to the public, people are still going in and working, and their number is 859-278-6072. This information that you can see, and I'll read through it for those of you on the phone. These are different resources and people within the center. Jennifer Garland is a social worker at the senior center. She is wonderful, and she specifically can help with financial assistance and food and supplies. Justin Halverson, he can help with technology assistance by the phone. Amanda Patrick, she can help with emergency medical supplies and equipment. Wendy Jett, you can email or call and ask for her, and she's going to give you some ideas and some tips on exercises and how to stay well at home. And then Miss Rose has some ideas on activities and being creative and doing some things in the home to keep your brain healthy and to keep you active and engaged. So the Lexington Senior Center again is 859-278-6072. And you can call and just say, hey, I'm having a really hard time connecting my computer to Zoom or to Skype, and I'd like to see my grandkids. And they will connect you with Justin Halverson. Or I need some transportation, and they'll connect you with Amanda Patrick. So the next slide is talking about food resources. I know we talked about God's Pantry earlier, which is the main one and the one helping the most within the region. And God's Pantry can connect you, if you're not local in Lexington, God's Pantry can connect you to the other food pantries within the region. So other food resources, the Kentucky Department of Agriculture does a commodity supplemental food program. It's a monthly food program for low-income seniors, and the sheriff's office again will deliver that food to you if you need it. Your local senior center can help you get an application for that program, or your local Area on Aging. Kevin Peach is the Kentucky Department of Agriculture Director, and his number is 502-782-9231. Shopping Angels, this has been in the news recently, but Shopping Angels is a volunteer organization that will pick up your groceries for you. You'll still have to pay for your groceries, but they don't expect or want or ask for any tips. There's no charge or fee for this. Stephanie Smith is the Kentucky State Coordinator. Shopping Angels is an online program, so you would need to register for it online at shoppingangelsglobal.org. So if you just search in your search engine, if you're connected to the internet, Shopping Angels Global, it'll come up and you can fill out the application for that. And then Full Cart is also a national program, and Full Cart provides a full cart full of groceries delivered to your home. There is an application. Unfortunately, it's all online at www.fullcart.org. The only thing they do ask is that you pay for shipping. So just keep that in mind.